With hypoparathyroidism, hypo refers to under, and parathyroid refers to the parathyroid glands. So hypoparathyroidism is a condition where there's an underproduction of parathyroid hormone. Parathyroid hormone comes from the parathyroid glands, which are buried within the thyroid gland, and their main job is to keep blood calcium levels stable. Now, the majority of the extracellular calcium, which is the calcium in the blood and interstitium, is split almost equally between two groups, calcium that's diffusible and calcium that's not diffusible. Diffusible calcium is small enough to diffuse across cell membranes and is separated into two subcategories. The first is free ionized calcium, which is involved in all sorts of cellular processes like neuronal action potentials, contraction of skeletal, smooth, and cardiac muscle, hormone secretion, and blood coagulation, all of which are tightly regulated by enzymes and hormones. The second category is complex calcium, which is where the positively charged calcium is ionically linked to tiny negatively charged molecules like oxalate, which are small anions that are normally found in our blood in small amounts. The complex calcium forms a molecule that's electrically neutral, but unlike free ionized calcium, it's not useful for cellular processes. Both of these are called diffusible because they're small enough to diffuse across cell membranes. Finally, there's non-diffusible calcium, which is bound to negatively charged proteins like albumin. The resulting protein-calcium complex is too large and charged to cross cell membranes, leaving this calcium also uninvolved in cellular processes. Changes in the body's levels of extracellular calcium are detected by a surface receptor in the parathyroid cells that's called the calcium sensing receptor. These changes affect the amount of parathyroid hormone that's released by the parathyroid gland. The parathyroid hormone gets the bones to release calcium, but it also gets the kidneys to reabsorb more calcium so it's not lost in the urine. And it synthesizes calcitriol, which is also known as 1,25-dihydroxycholecalciferol, or active vitamin D. Active vitamin D then goes on to cause the gastrointestinal tract to increase calcium absorption. Altogether, these effects help to keep the extracellular levels of calcium within a narrow range, between 8.5 and 10 milligrams per deciliter. The most common cause of hypoparathyroidism is removal of the parathyroid glands during thyroid or parathyroid surgery. Another cause includes autoimmune polyendocrine syndrome type 1, which destroys parathyroid glands. There are also genetic causes like DiGeorge syndrome, which is the deletion on the 22q11 part of the chromosome that causes a variety of immune and cardiac defects, as well as parathyroid glands that can't produce enough parathyroid hormone. There's also autosomal dominant hypoparathyroidism caused by a mutation in the parathyroid cell's calcium sensing receptor. Finally, there's pseudohypoparathyroidism type 1A, or Albright hereditary osteodystrophy, which is when the parathyroid hormone isn't the problem at all, and instead the kidneys and bones simply don't respond to parathyroid hormone because of a defect in their parathyroid hormone receptor. Regardless of the cause, low levels of parathyroid hormone lead to hypocalcemia and hyperphosphatemia. This makes neurons more excitable, which can trigger tetany, or the involuntary contraction of muscles. Other symptoms include paresthesia, which is numbness or tingling of the hands, feet, and around the mouth, as well as changes in cardiac output and calcification in places like the basal ganglia or the lens of the eye. The spontaneous firing of neurons leads to Chvostek's sign, which is when facial muscles twitch after the facial nerve is lightly finger-tapped 1 centimeter below the zygomatic process. It can also cause Trousseau's sign, which is where a blood pressure cuff occludes the brachial artery, and that pressure on the nerve is enough to make it fire, which results in a muscle spasm that makes the wrist and metacarpophalangeal joints flex. If the hypocalcemia and hyperphosphatemia are severe, this can lead to life-threatening complications like severe seizures and cardiac arrhythmias. Now, diagnosis is based on blood tests for parathyroid hormone, calcium, vitamin D, albumin, phosphorus, and magnesium. Also, an electrocardiogram might have changes like a prolonged QT, prolonged ST segment, and arrhythmias like torsade de pointes and atrial fibrillation. The immediate treatment for hypoparathyroidism is to give calcium and vitamin D supplements to bring calcium levels back to normal. Long-term treatment can include taking recombinant human parathyroid hormone to make up for the body's underproduction. Alright, as a quick recap, hypoparathyroidism is a condition of underproduction of the parathyroid hormone. This causes low levels of extracellular calcium and high levels of phosphate, which makes neurons more excitable, with symptoms including tetany and cardiac dysfunction. It's most often caused by surgical removal of the parathyroid glands, but can also be due to genetic conditions like DeGeorge syndrome.
Helping current and future clinicians focus, learn, retain, and thrive. Learn more